Hi Sam, how you doing? My name is Sebastian Osler and I'm a student physical therapist with Bowling Green State University. Today I'm just going to be giving you a consultation with some of the medications that you're going to be taking. So the first drug that I want to talk about is the losartan that you're taking. This is for your hypertension. This directly controls that hypertension. So hypertension is when your blood pressure is elevated, which you've been just diagnosed with stage 2 hypertension. So this medication is for that, and you're also taking this in combination with the hydrochlorothiazide also. So this specific drug, though, it helps just relax your blood vessels because your blood vessels have become tightened, which increases that blood pressure, and this helps just relax them a little bit. So some adverse reactions that you may be experiencing with this would be hypotension. Since your blood vessels are being widened, we don't want that blood pressure to fall too far, so that would be the hypotension. And then you also may be experiencing some cough or some fluid in your body that may be causing some pain. So next we're going to talk about the metformin. This is your type 2 diabetes mellitus medication, and this basically just helps restore the body's response to insulin. It helps decrease that blood sugar that the liver produces and that the intestines and stomach absorbs. Some adverse reactions that you may be experiencing with this could be nausea, vomiting, diarrhea, flatulence, or abdominal cramping. And then we're going to talk about the liraglutide that you're taking, or the Victoza. So this specifically is also for the diabetes mellitus. It also helps control that blood sugar and also helps with the weight loss too. If there's too much weight loss, that could be an adverse reaction or some nausea, but that'll just help keep your body weight down to kind of help with that diabetes mellitus. Next, we're going to talk about the celecoxib that you're taking. This is for your pain. So this is going to be for your pain or any type of osteoarthritis or rheumatoid arthritis. It doesn't look like you have that, but this can help with prevention of this also. So this medication inhibits the enzyme called COX-2, which basically helps deal with inflammation and pain that you're feeling in your low back. Some adverse reactions to this drug specifically could be an upset stomach. Next, we're going to talk about the Lexapro that you're taking. So this is for your depression and anxiety. This selectively inhibits the reuptake of serotonin in the CNS. And some adverse reactions that you could be feeling with this is insomnia, diarrhea, or nausea. And I know you just asked us the question if you're not experiencing any change in your mood and anxiety, even though you just took it 2 weeks ago, and you're wondering if you should stop taking it. I would recommend that you continue taking it or talk to your physician about other alternatives. But Lexapro typically takes around 6 to 8 weeks to see full improvement effects. So I would continue taking it, see if it causes a change during those 6 to 8 weeks, and then I would talk to your physician about any type of alternatives that you could be taking with this. So next, we're going to talk about the hydrochlorothiazide. That's also for your hypertension, like I stated. So this basically just helps with the excretion of all of the fluids in your body. So it helps with the excretion of sodium and water, and it also inhibits that sodium reabsorption, and it also produces or promotes the excretion of chloride, potassium, hydrogen, all the fun substances and chemicals that are running around in our bodies naturally. And this may lead to increased urination, which could also lead to electrolyte imbalances. It can increase the lipid content in your body. It can lead to hyperglycemia or increased blood sugar, which would be bad. And it could also lead to some photosensitivity. Next, we're going to talk about the budesonide and with the formoterol, or the inhaler that you're taking. So this is for your asthma. This medication works by acting as an anti-inflammatory process, an immune modifier. So this basically just helps clear up those airways. It decreases the frequency and severity of asthma attacks, and it also helps improve those asthma symptoms that you may be experiencing since you've had asthma for a while. This could lead to throat irritation too. and may lead to a mild cough too. And the last medication we're going to talk about is atorvastatin, or the Lipitor that you're taking. Excuse me. So this is for your cholesterol, and this basically just helps inhibit an enzyme that's in your body that helps with the creation of the cholesterol. It lowers the LDL cholesterol, which is good because we want those levels to be lower, and it helps increase the HDL cholesterol in the body, which is good because we want those to be higher. This can lead to some muscle pain, some joint pain, or maybe even a myopathy. So with all these medications, I want to just narrow down 3 drug classes that we're going to talk about that we're going to prioritize in physical therapy, or we're going to prioritize considerations based on your past diagnoses and what you're coming in for today. So the first one I want to talk about is your anti-hypertensive agents. So with the losartan, we want to assess for muscle pain and back pain. That could be musculoskeletal, or could be from a muscle or part of your skeleton. And this will just basically help if the pain is caused from the drugs, or if the pain is caused from a muscle injury or some other type of MSK injury. We're also going to be assessing for blood pressure periodically because of this. We don't want the blood pressure drop too low, so we are going to definitely be assessing that blood pressure probably before and after exercise. We're also going to monitor for signs of hypoglycemia. Since you are diabetic, we want to make sure that we're monitoring those signs of your blood sugar, specifically during and after exercise. And common neuromuscular symptoms include anxiety, restlessness, chills, cold sweats, confusion, and a wide variety of other things. But we just really want to make sure that we're checking those blood glucose levels frequently. And then we're also going to assess for dizziness that may affect your ability to walk or your balance while standing. And we're also going to assess your body weight periodically. We're not going to do it every single physical therapy visit, but we are going to want to assess that body weight just to make sure that you're not gaining weight or anything like that. For this specific drug class, we're going to avoid any type of physical therapy interventions that may lead to vasodilation or the widening of those blood vessels, since the drug is already widening those vessels. So if we keep widening them, that can lead to hypotensive crisis, which just means that we got a real emergency on our hands because your blood pressure dropped too far. We're also going to try to minimize orthostatic hypotension, which is basically just meaning when you get up too fast and you feel all dizzy and stuff like that. We're going to try to avoid this by having you just move slowly while getting into an upright position. So if you're laying on your back, just moving slowly, getting up. So I want you to just be aware of any type of prolonged headache, insomnia, chest pain, nasal congestion, or GI issues such as nausea, diarrhea, abdominal pain, and indigestion with this. And I know you're experiencing some severe pain and you're wondering what type of additional over-the-counter medications that you can take. I would recommend acetaminophen and Tylenol, but because of the medications that are on your list, I would take them in moderation and just make sure that they are that you're not taking too much of it, because it can lead to increased adverse reactions of some of these medications that you are taking. So next, we're going to talk about metformin again, and talk about your diabetes mellitus medications. So basically with this, we're going to be assessing for hypoglycemia during and after exercise, just like with losartan. But we're also going to be monitoring for signs of lactic acidosis during the exercise. And signs include confusion, lethargy, shallow rapid breathing, tachycardia, that hypotension that we talked about, nausea, vomiting, and we're going to be notifying your physician if we are experiencing any of those signs. So with physical therapy interventions, we're going to implement an aerobic exercise program into your physical therapy interventions, but we're going to be cautious with this because of that increased risk of lactic acidosis, and also because of your asthma. We want to implement aerobic activity so that we can help improve that, but we also want to have caution with it and monitor any type of symptoms such as chest pain or shortness of breath if you're experiencing any of those, because that would just lead to the termination of it. Then also we're gonna have a source of glucose with us, so any type of fruit juice while you're doing these exercises, just to make sure that if your blood sugar levels drop, that we have something that can bring them back up. Yeah, I want you to monitor your blood glucose. I know you've already been doing that with this while on this medication, but I want you to definitely monitor those glucose levels before and after exercise. I really want you to focus on your nutrition. I want you to make sure that you're eating good foods, and this can help with your cholesterol, and this can also help with your blood sugar, and I want them to fall within the glycemic control limit. So with this, we're going to be printing out all of this anyways, but I'm going to have a table there that will just say which glycolytic levels that we want you to fall under. And I want you to be aware of symptoms of hyperglycemia or increased blood sugar, which could be confusion, drowsiness, flushed or dry skin, rapid deep breathing, loss of appetite, or unusual thirst. And if you are experiencing any of these, we're going to have to adjust the drug doses that you're already prescribed with. And also with the metformin, you may also be experiencing those symptoms of GI problems such as the nausea, vomiting, abdominal pain, etc. So the very last drug that I want to talk about, just to that we're going to prioritize during physical therapy, and that we're just going to be making sure that we're keeping an eye on, is the celecoxib. So with this, during examination and evaluation, we're going to watch out for any type of signs of GI bleeding, abdominal pain, vomiting, blood in your poop. We really want to make sure that we are monitoring these, because these could lead to some severe reactions that can lead to some serious injuries or possibly death. So I just really want you to monitor these signs, and if you are experiencing any of this, refer to your physician immediately or go to the doctor. You're also going to want to monitor for signs of myocardial infarction or stroke. This could be signs of chest pain, pain radiating to the jaw or left arm. This could be speech problems, visual disturbances. Although they are rare, celecoxib has been associated with it, so I just want you to be aware of it. And if you are experiencing any of these signs, seek immediate medical assistance. Then with this drug too, since this drug is for pain, we want to make sure that that pain is working well, or that this pain medication is working well, and you're not experiencing pain or decreasing movement. So we want you to be able to increase that movement and decrease those impairments. So with this specific physical therapy interventions with this drug, we're going to implement appropriate manual therapy techniques, use physical agents, and basically just therapeutic exercises to reduce that pain and improve that function. But because of the risk of myocardial infarction, we're going to use caution with any type of aerobic exercise, and especially with your asthma too. So like I said, we're going to implement it, but we're going to use caution with it. Basically just going to the level that you could tolerate it at, and also monitoring those blood pressure, the heart rate, and any type of fatigue levels that you're experiencing with these. So basically just some other additional instruction that I'm going to give you. I want you to be aware of the myocardial infarction and stroke signs and symptoms, since I already told you those. I want you to be aware that this specific medication is more effective when you take it before it becomes too severe. So if it becomes really severe, its effectiveness may drop. But so if you are taking it, take it before physical therapy, so that we can test to see if that is improving with your participation in physical therapy. I also want you to reduce any type of alcohol intake. I know you're only drinking 2 to 4 alcoholic beverages a week, but I want you to just be aware that alcohol intake increases the risk of gastric toxicity, which can lead to that vomiting, nausea, all that. So I want you to reduce your alcohol intake to preferably 0 alcohol, alcoholic beverages during the week. And I want you to be aware that that Tylenol and acetaminophen that I recommended you, I just want you to be aware that these NSAIDs with the celecoxib can lead to increases in risk of overdose or toxicity. So I want you, like I said, take those in moderation. Don't take them like every single day. Like don't take too much of the acetaminophen and Tylenol with the celecoxib, since the celecoxib is also for that severe pain anyways. If you have any questions, just please let me know, and I hope you have a great day.